Good morning, everyone. I'm going to present a spotter from. So, 28 years old Mrs. B from Jargon has been presented with 1 year history of skin lesions, now presented with a history of fever and worsening of skin lesions for 10 days. So, this is a spotter. So, I'll describe the lesions. She had ulcerative.
No. Let them give the diagnosis first, then you describe the lesion.
Okay. And
you're putting Slido?
No, sir. Like, there are so many images first.
Dermal lesion, yes.
Pyoderma gangrenosum.
I will give one more clue. This is a patient diagnosed to have a leprosy in end of May. She was started on multibacillary drug regimen in the end of May. Now she had come with the exaggerated skin lesions and new lesions. She developed with the pus and necrotic lesions for the past 10 days. Now the infiltrative nodules in the knee and the face and the ears also. Now the
Huh? Someone said it, I think. I heard someone saying it. Say it a bit louder.
ENL.
Okay.
So this is a lepromatous leprosy patient with has come with ENL, erythematous nodus leprosum. The special type is pustular and necrotic erythema nodosum leprosum. So whenever the leprosy patient come with the exact worsening of skin lesions, we would think of lepra reaction. So there are two lepra reaction, type 1 and type 2 lepra reaction. Special type of lepra reaction is Lucio. So in this patient, whether it is type 1 or type 2 or Lucio, we should differentiate. So to differentiate from type 1 or type 2, so this patient is classically presented with the infiltrative nodules. It's more on the lepromatous side. So it will be mostly type 2 lepra reaction only, because the patient presented with the constitutional symptoms fever. So it is more of type 2, and it was lesions for fresh red, painful, tender cutaneous nodules, which ulcerated, and nerves are not as involved as a type 1, and she had no complications. So based on this table, so patient fit into type 2 lepra reaction. Type 1 we ruled out, and Lucio phenomenon is specifically a special type of lepra reaction. This is uniformly diffuse, shiny, infiltrative, non-nodular form of lepromatous leprosy. This is only in untreated cases. My patient was treated cases, so Lucio phenomenon is unlikely, and also by seeing itself clinically, we can tell this is not Lucio phenomenon. So we ruled out Lucio phenomenon. So we ruled out type 1 lepra reaction. So this is type 2 lepra reaction. In the type 2 lepra reaction, there is multiple differentials for type 2 lepra reaction. This is sarcoidosis, tuberculosis, streptococcal infection, intestinal infection, drugs, rheumatoid arthritis, rheumatic fever, and systemic lupus erythematosus. This is clearly a case of lepromatous leprosy. We don't need to differentiate all this for a type 2 lepra reaction, because then this is clinical diagnosis only. Criteria for diagnosing erythema nodosum leprosum is there is one major criteria and there are multiple minor criteria. There should be one major criteria present and one minor criteria present should make a diagnosis of ENL. So this patient had major criteria: the sudden eruption of tender papules, red papules, nodules, plaque which may ulcerate, and minor criteria: fever, tender enlarged nerves, increased loss of sensation or muscle power, arthritis, lymphadenitis, epididymal orchitis, edema of extremity surface. So in this patient had major criteria and she had fever. So we diagnosed clinically this is erythema nodosum leprosum ulcerative type. So variants of type 2 lepra reaction is there. There is one is classical, that is red tender nodules which may or may not ulcerate, and necrotic ENL, and vestibulobullous type 2 reaction, and type 2 reaction without ENL. So patient present without skin reaction, only systemic manifestation only. So there is no need to this doesn't change anything in the treatment. So whatever the treatment same only, whether it is mild or severe, we give treatment based on the severity only. This patient has necrotic ENL variant. This is also clinical diagnosis only, because since patient had fitting into the criteria, she had necrotic skin lesions. So we come to the conclusion this is a variant of necrotic ENL. Then treatment of ENL, first we have to rate the severity of type 2 liver reaction. So two severities there, mild, severe. So based on the severity, we'll give treatment, and we have to look for the precipitating factors also. If it is there, we have to treat that also.
Yeah.
And continue or start multi-drug therapy. If the patient doesn't have start.
Any other questions?
Clinical diagnosis, sir. Biopsy we didn't do, sir. No, sir.
You diagnose or doctor?
Both.
So no more questions. We'll go on to the last case from yeah, go ahead. Medicine 3, disloyal by Jagat Cherpian.
Good morning. I will be presenting on disloyal on behalf of Medicine 3. Moving to the case history, 58-year-old Miss M from Vellore presented with nocturia for 2 weeks and a dizziness and fall for 3 episodes for 12 days ago, and vomiting for 3 days, and a generalized tonic-clonic seizure for 2 days, and coarse tremor for 2 days. And she's decreased water intake to avoid getting up